Medicare and Medicaid are the two most complicated and confusing programs in America, and somehow we expect seniors to understand them perfectly when they turn 65. So if you're a senior, if you're a case manager, a family member, or you work with seniors at all, I'm going to explain what you actually need to know to understand them. So Medicare has four parts. Think of them like little Lego bricks. You put them together and that builds your coverage. There's A, B, C, and D. I'm going to talk about what each one is and how they work. So Part A, it pays for your hospital stays, pays for hospice care, it pays for short-term rehab. You earn Part A by paying taxes to Social Security on your Medicare tax for 10 years or 40 credits with Social Security. Part B is what covers your doctors. It's your medical coverage. This one has a monthly premium in 2026. It's about $202 for the standard premium, and it goes up based on your income. A and B are what is considered original Medicare. You get a red, white, and blue card from the government. It says your name, a Medicare ID number, and that is original Medicare. And it's basically 80/20 coverage as a high level summary. Now, what is C and D? Part D is the prescription drug coverage. If you do not take prescription coverage and you delay your enrollment because let's say you don't need it and you choose to get it when you're 75 or 85 and you have an expensive drug, they will penalize you for the whole time that you went without coverage. There are exceptions to this. If you're a veteran, you go to the VA for all of your medicine. You really don't need it. You can get a discount on other plans for not having the drug coverage. So Part D is the prescription drug coverage. You have to get that through a private company contracted with Medicare. The last one is Part C. This is essentially private companies that contract with Medicare. It's known as Medicare Advantage. If you have A and B, you can enroll into a Medicare Advantage plan. A lot of them have a $0 premium. So there's no additional cost to enroll in them. Sometimes that premium is even a negative premium and they give back some of that $202 you pay for Part B. Essentially, if you have A and B, original Medicare, you are eligible for the Part C and Medicare Advantage plans, but not required. You can get them with or without the drug coverage. They work essentially like a normal health plan. They have HMOs, they have PPOs, they have doctor networks, and they have a list of benefits that have a copay for everything that you need. Now, it's important to understand there's really two main options when you sign up for Medicare. You can stay with original Medicare A and B with a Part D only plan for drugs, and you can buy a secondary policy called a Medigap plan to cover your leftover 20% coinsurance after your deductibles on original Medicare. The advantage to this is you basically have a fixed cost for your healthcare and you have really no doctor networks. A lot of doctors prefer this because they don't have to deal with insurance claims, denials, billing. They're billing the government directly. The cons, and there's three big gaps. The government does not cover dental, vision, and hearing in original Medicare. And so those you'll have to either buy a standalone policy for or just pay cash. Typically the Medicare Advantage plan, you get a dental, vision, and hearing included. And those plans change every year and they change based on your zip code. And so that's where open enrollment comes in and you want to renew your coverage and check at least every year and make sure you're on the best plan. With the Medicare supplement policy, so if you're on original Medicare and you want to have a secondary plan to cover your 20% coinsurance, then you can apply at any time. But if you don't have what's called guaranteed issue or guaranteed acceptance, then they can look at your medical history. And based on your medical history, they can either deny you coverage into the plan entirely or they can upcharge your premium. Whenever you decide to start Part B, during the first 6 months, you have guaranteed acceptance when you're new to Medicare. You also have a guaranteed acceptance window when you move to a new state, or if you're on an Advantage plan and it leaves the market, you'll have a guaranteed acceptance window. And those rules do vary by state about when you do and don't get guaranteed acceptance. In summary, you can think about Medicare as two different types. You have Medicare Advantage, which is basically pay for what you use medically, and you get included coverage for dental, vision, and hearing. Your drug coverage is included. Typically, if you don't use a lot of medical, you save money on an Advantage program. On the supplement plan, you can just pay your premium and you have 100% coverage. So in a large medical expense, you'd be less out of pocket. Let's talk about Medicaid, because that's a whole different ballgame. Medicaid is a state-run program, and it's meant to cover people under certain income or asset limits. So if you're below the poverty line in your state, you can apply for Medicaid and you can get medical coverage, and you can have this with Medicare. Medicare will always be primary. So, and if you also have Medicaid, Medicaid works the same way a Medicare supplement plan would, where it pays for your co-insurance and out-of-pocket costs. So you basically have 100% coverage if you have both Medicare and Medicaid. You'll also be eligible for special type of Part C Advantage program if you have both. They're called dual eligible programs. Typically, they add some extra benefits to incentivize you to enroll, like dental, vision, hearing, food cards, transportation, things like that. Medicaid sounds great. It does come with a hidden cost, especially if you're a homeowner. When you pass away, they will try and collect on whatever they've paid out. So if they paid a bunch of medical expenses for you and you own a home and your son lives in the home, they can force the sale of the home once you pass away to collect or to recollect what they paid in your medical expenses. Some states are more lenient and some states are more aggressive. Some states require you to have an attorney to do your Medicaid planning. Others have licensed Medicaid planners. It gets really, really complicated. It's basically like a whole new tax code when you get into Medicaid. So just know if you own an estate, if you own a home, if you own any kind of savings and you want to get Medicaid, really important to plan ahead. So hopefully this was clear enough to help you understand the basic nuts and bolts of Medicare, Medicaid, and the Asset Recovery Program. I am a licensed realtor in the state of Utah, and I'm a licensed Medicare broker in multiple states. So if you want to look at different types of Part C, Part D, or Medicare supplement coverage, you can check out my website. You can self-shop and you can get a hold of me for a consult. If you're looking at Medicaid planning, downsizing, or long-term planning, considering a senior community, or trying to age in place and get a Medicaid waiver, that gets more complicated, but I would love to do a consult to look into your specific case, what you're eligible for. It varies based on your income, your health, your zip code. There's a lot of variables. So I can't do one blanket video about all the different programs, but I can say that there are options out there, and please feel free to reach out to me if you're curious about what your options are.